Last year, the CDC estimates there were between 27 and 54 million influenza cases in the U.S., resulting in as many as 58,000 deaths as the fall approaches and the threat of a so-called tripledemic of flu, COVID, and RSV looms. Health experts are urging Americans to prepare.
Dr. Jamie Rutland is a pulmonary and critical care doctor and a spokesperson for the American Lung Association. Doctor, thanks for being with us.
Hey, thanks for having me tonight.
What is your main message ahead of this so-called tripledemic?
You know, when you think about the tripledemic, first of all, we have to be able to define what that is. And what that is the presence of SARS-CoV-2 infection, the presence of RSV infection, respiratory syncytial virus, and the presence of influenza. These are all respiratory viruses that are easily transmissible through respiratory droplets. That is, every time we speak, every time we talk, we are just secreting these little droplets. People next to us inhale them, and it can cause an infection if that person is already infected. My main message is really simple. We want people to be aware of these respiratory infections, and we want people to protect themselves, especially those that are at significant risk of severe disease. That is the main message.
And that's the message that we heard last year, and we're hearing it again, as we should, just as a reminder as we head into the colder months. The American Lung Association has United Against Flu. That is your new campaign. What is that all about?
So United Against Flu is a campaign to educate and create awareness for the civilian population about vaccination. We want individuals to go out and get vaccinated against these common respiratory viruses like influenza, especially SARS-CoV-2, and for some individuals that qualify for respiratory syncytial virus.
You know, though, there's a lot of skepticism out there, especially like with COVID. There were so many people who got vaccinated the first time around, and then we've seen this big drop-off with people not wanting to get boosters, not getting them. Why do you think there is that skepticism, and what do you say to those folks?
You know, I had the wonderful opportunity one day to be able to interview Dr. Anthony Fauci. And when we interviewed, one of the stories and one of the things that I said was, we want to be able to educate individuals on what vaccination is. I want individuals to understand what vaccination means so they can make an informed decision. I don't just want to tell people to go get vaccinated. I want them to understand that what vaccination does is it allows your immune system to get a glimpse of a pathogen. So that way, when the pathogen does present, the immune system is allowed to organize itself in a very efficient and effective way to clear the pathogen very quickly.
Now, in terms of, for those folks watching who do want to get boosted and who do want to get their annual flu shot, can you get them simultaneously? Are you supposed to stack them one after the other? What do you recommend?
You know, again, what I recommend and what can be done safely. So let's talk about first what can be done safely. You can get both a SARS-CoV-2 vaccine or a COVID vaccine and an influenza vaccine simultaneously. It's safe and effective. But from my perspective, you know, I have children. It's a lot easier to watch one of my kids than it is to watch 3 of them. And I think about vaccination in that same way. I like my patients to get one vaccine, wait 7 to 10 days, and then go ahead and get another vaccination, because I want the immune system to focus and concentrate on just one antigen instead of having to focus and concentrate on more than one. That's my opinion, and that's what I advise my patients to do in my pulmonary clinic.
What about folks with asthma? You say they're especially high risk right now.
Yeah, you know, the way the lung actually works is the lung is a bunch of pipes that leads to a bunch of balloons stacked on top of one another. Asthma is chronic inflammation of those pipes that carry air to the balloons. And so when you have this underlying chronic inflammation that's already present, when you have a virus that introduces itself, what does that lead to? More inflammation. So those pipes become more inflamed. You cough, you produce mucus, and perhaps that inflammation even travels down towards the balloons. And that becomes a real problem, because in those balloons, that's where gas exchange takes place. That's where oxygen gets into your bloodstream and gives you the energy that you need to be yourself, that you need to be able to deliver the news, as you guys do oh so well.
Trying to butter us up at the end of the interview here. We appreciate it. Now, the campaign is United Against Flu. For more, you can visit lung.org. It is as simple as that. Dr. Jamie Rutland, thanks so much for being with us tonight.